Okay, we're going to move on to the lower lobes. So this is going to be the anterior basal segment. If you look at the pictures of the lung lobes and segments, the anterior, it sneaks out a tiny bit anterior, but most of it's lateral. So why they named it that, I don't know. Nobody asked me. But for this one, your patient's going to be just sideline. Okay, so we can certainly put a pillow between the knees for comfort. And your table is still going to be in the Trendelenburg position for all of the lower lobes. Now the foot of the bed is going to be up 18 inches or 30 degrees. Okay. Your hand placement is going to be at T9 through 10. Okay, so I can certainly count down her spinal segments, and I encourage you to do that because it's good practice. But once you do that, I'll show you the trick. The trick is, if I find her waist and I tickle her and I put my hand right next to that, I guarantee I'm at T9, T10. So that's the easy trick, okay? If I have small hands and I have a large patient, I could do this with 2 hands, but most of the time you'll be able to do it just with 1. You want to be real careful of the floating ribs. Okay, we don't want to percuss on the floating ribs. That would be dangerous. We could certainly fracture. Okay, let's do one more real quick. Posterior basal, and they named that one pretty good because we're going to be percussing the posterior side of our patient. Would you lay on your stomach, please? And I'm going to put one pillow up under your hips. Okay, so table is up 18 inches. My patient is flat with one pillow under the pelvis. Okay, it has to be the pelvis. If you put it under the chest, you've just taken away some of the incline. Okay, if you put them up under the head, we've again taken away some of the incline. So this is where we should be. Okay, hand placement, and I can treat both lungs at the same time, are going to be T7 through 9. So inferior angles are T6, T7, T8, T9. So right here between these spots, this is where I want my knuckles, the middle of the cup. Okay, so I can certainly do that from here. I could do it from here. 2 to 3 minutes. At the end of 2 minutes, take a deep breath in and exhale and cough, cough.
What was your hand placement again?
T7 through 9.